So I grew up out southwest Sydney watching my dad run marathons, so endurance sports are in our blood. Grew up playing cricket and soccer and softball, anything I could get my hands on really. Loved sport mad when I was a kid. And carried it on through school, absolutely loved it. Had a little break at uni and then in my early 20s and took it up again after kids actually, so pretty much late 30s, and jumped on the bike only 2 years ago. I took up the bike to have a season off soccer. I was playing for Avoca with the women's team and broke my foot a couple of times and just needed a proper rest, so thought I'd have a season on the bike through winter instead, and I've never looked back. It doesn't hurt, the bike doesn't hurt. So it's so good for my head and fitness and everything, yeah. Yeah, so I guess when COVID took off, all the events were cancelled, and I had my eye on a couple of events, and they got postponed. So I really wanted a goal to get me keeping on training through winter. And I'd heard of this Everesting challenge and had a look at it with my dad, and we thought that we'd never be able to do it because of it. It would just take too long and be too exhausting. But then I got a bit faster on the bike and it seemed like it was finally possible. So chose Bumble Hill out in Yarramalong on the Central Coast, and rode up and down 31 times. So that's the height of Everest, 848 metres in one session. So it took me about 16 hours riding time, but 20 hours all up with breaks and ice creams with the kids and everything in between. So fantastic, challenge and achievement, and yeah, really epic, but raised a lot of money for Tour de Cure, which is a cancer charity along the way. So yeah, very fulfilling. Well, Tour de Cure is a cancer charity that raises money for Australian research. And also prevention services and supports that go to families with loved ones suffering cancer. So it's a really important charity. They're very professional. They've got an independent board that oversees their research grant allocation and that sort of thing. And I had a good look at it, and they're a group of cyclists, which resonates with me, and we trained together for a big event earlier last year, and yeah, it's a good way to focus your attention on something other than the pandemic, I guess. So I got to be part of a group of only 15 riders that were chosen to ride from Newcastle up to Southwest Rocks, about 850 k's over 6 days, and we were able to test their COVID-safe protocols to make sure that we could ride even with the pandemic on. So we were part of a bubble of only 20 people and weren't allowed to contact anyone outside that bubble for the time that we were riding. And Sunrise on Channel 7 shadowed us the whole way with a camera crew, and they're making a documentary now with Mark Beretta. It's going to be released in a month or so, sharing the stories of the other riders who are all really closely connected with cancer. They've all got really special stories to share, and it's all about raising awareness as well. So the importance of keeping up with your cancer screening checks and staying fit and healthy to prevent cancer in all of us. Yeah, poor old body. I was a bit super keen after the Everest, and went on a Tour de Cure training ride only 3 days later, and got a little hip niggle, but managed to sort of shuffle through and make it to the event only 1 month later, and got through those 6 days. It was absolutely, a fantastic event, and so inspiring to ride with those other people who are phenomenal athletes. Some of them have represented Australia in their various sports, triathlon and Aussie rules. There was Tony Lockett there, which was pretty fun to hang out with him. Yeah, it was great, a very physical challenge on the body, but also the mental sort of challenge, taking on the stories about cancer and survival and also loss was, yeah, pretty touching and special. you know, my husband and I are pretty keen to set an example for our kids too. He's training up for Port Macquarie half Ironman, and you know, together we tag team, we're training all the time, and the kids just think that's normal, so hopefully that little bit rubs off on them. It's been so important to stay fit because it's been such a stressful last 12 months. You know, it's as GPs, we've kind of borne the brunt of the community anxiety, I guess. You know, lots of people are feeling very worried, and you know, GPs are the front line of just looking after the whole community, so helping people get their heads around what's going on and staying safe, and you know, coping with the loss of their jobs potentially, and other financial stresses that's come along with it. So it's been a big year looking after everyone, and riding the bike has just kept me going. It's pretty meditative for me. I sort of jump on the bike, and after an hour or so, I sort of, you know, suddenly have a light bulb moment, and I've solved a problem that I couldn't work through sitting at my desk. So it's been really important. Yeah, so we've seen a big spike in mental health issues, of course, and we're still frontline and checking for COVID, so we're swabbing for COVID in our practice and reviewing people with respiratory illnesses, but now things have changed, so we have to get up in a full gown and mask and gloves and eye shields, and run a special respiratory clinic at the end of the day to see sick kids, where we usually would have just, you know, ushered them into our surgeries. And so there's lots of practice protocols that have changed, and we've also been helping to keep the Aboriginal community on the Central Coast safe, so we've come up with a pandemic response plan that sort of makes sure that if COVID gets into one of the community households that sometimes can be overcrowded with very old people and very young people living together, and the elders are often looking after the kids who are attending daycare, so they're at higher risk of catching COVID. So we really wanted to make sure that there was a plan to keep those people safe in case COVID infiltrated the Aboriginal community, because previous pandemics have been absolutely devastating for them. So that's been a big part of my year as well, and it's been really successful so far. The messaging to the community has been fantastic, and everybody's jumped on board, and they have a big interest in keeping fit and healthy, so it's really gelled. You know, they've been watching me doing my various escapades on the bike, and getting behind with full you know, full enthusiasm, and it's been really great to sort of share my job and the fitness to promote health and happy lifestyle. Yeah, as a medical student actually out in Bathurst in Western New South Wales, I was on placement there and noticed there was a big Aboriginal community, and there was no Aboriginal health centre there specifically, so kind of thought, well, let's see what we can do and start up a clinic where people can come and feel culturally safe, and got talking with the local Aboriginal elders and set up a health clinic where people felt comfy coming along. That was pretty fun and a good experience for me, being a newbie to medicine, and that sort of kick-started my passion for Aboriginal health. Yeah, I'm hoping to ride another Tour de Cure event, the Signature Tour. They're going to try and run in March, which is only sort of 2 months away now, and going to ramp up training again for that, and hopefully if the Sydney COVID cluster settles down, we'll be able to do that, and that'll be a 6 or 7 day ride up north through New South Wales again. So yeah, raising money and sharing the stories about cancer and staying healthy. It makes it really nice that we've already tested that COVID safety, and it was very successful, and I think and certainly I think it was the only tour that they've ever run where nobody got a sniffle or anything at all. So they'll continue those social distancing and other measures well after COVID has gone, and I think and we all will. We're getting used to the new normal, aren't we? So yeah, hopefully we'll be able to ride regardless. It's been a massive year actually. I've done over 11,000 Ks on the bike, which is, yeah, it's huge, and this is my first day of holidays after a big 12 months, so I think I'll probably fall in a heap, collapse on the couch for a couple of days, and you know, but the bike is just so much fun. Oh, I think whatever it is that you love doing outside work, keep doing it. It's so important to stay, you know, active and well mentally, whether it be art or music or drama or whatever it is, your hobby. Just to immerse yourself in that regularly, because it's so important to stay well balanced and active and well.